Hey, how you doing? This is Dr. Dave with Paragon Chiropractic, and welcome back to this week's video blog entitled Stretching and Exercise with an Injury. There you go. This is a big one. A lot of times, people will, more often than not, that's probably the best way to put it. More often than not, patients mistake their injuries as nothing more than a pulled muscle or something being out in their back, right? And so they undergo aggressive stretching and exercise and things along those lines to try and make the pain go away. Only it didn't work. How do I know it didn't work? Because here they are 2 weeks later standing in my office still in pain and oftentimes worse than they were in the first place. All right? So when is stretching appropriate and when is it not? This is a good question. In my opinion, a pulled muscle would require almost no treatment at all. And as a person continues to be active, they will actually feel better, and they'll feel better right up until they stop being active, at which time the tissue will get a little tight again, and they'll notice some stiffness with that. But once they return being or resume being active, stiffness and pain go away, and life is pretty good. Usually, with something that is truly just a pulled muscle or a little something, a decent night's sleep or a day or so, and they feel much better and they have little, if any, attention on their injury. Okay? Now, you're in day 3 and you've been stretching and it's still, this isn't a pulled muscle. It's not a little something out in your back. After the person is no longer experiencing any pain or symptoms, if they enjoyed stretching or exercise prior to the injury, they can resume light stretches and those postures and attitudes that mimic their typical activities of daily motion, or you get what I'm saying. So you'll find a lot of times people get into stretches and there's at no point in the time of the day do they ever take their leg, put it around their neck and jump up and down. Yet that's the stretch they're going to do because some guru said that's really going to get that one spot in the hamstring. If you don't do it during the day, you never do that, that is not a good stretching posture or position, right? This would also include resuming exercise. And whenever you start to feel a little bit better, you go back and you start to engage in the motions of your exercise. Don't load any weight on it. So try an empty bench or an empty press or an empty curl or whatever it is that you're doing, an empty squat, and see how you do. It's like, oh, you see, God, that kills. Then don't load it up with 500 pounds. Yeah, when I go to squat down, see, I get a stabbing right there. Good. You're not going to stretch that out or make it feel better doing a 1,000-pound squat. Sorry, I know a lot of you are going to discontinue watching this video right now because I just broke your heart, but it just doesn't. So you just gradually start to add a little bit, and you got the motions down, then you add a little bit, gradient, 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 until you're back to your normal routine. If you do want to stretch and do things, I recommend using the stick. I like that really well, or the foam roll. Those work fine too. So you'll get all of the benefits of stretching without putting yourself into weird positions and stretching tissue. And we'll explain why you don't want to get into those weird positions and stretch that tissue. All right? So here we go, and I'll explain this. Once you start feeling better, there really would be no need to continue stretching in the first place. So if you do decide to stretch or do something, your big question is it working, right? If not, and what I mean by, are you loosening, staying loose, and feeling good? If it's working, great. If not, do not stretch or continue stretching or continue doing exercise. You are hurting yourself, all right? Basically, stop harming yourself. Here's a few problems, right? Most people injure themselves worse than they give themselves credit for. Oh, it's just a little something or other. No, it's not a little something or other. See where this bone's sticking out? Yeah. All right. Secondly, most injuries are ligamentous, which means they are injuries to the ligaments. Ligaments go from bone to bone and hold bones together. The other problem is, thirdly, When stretched, a torn muscle and a tight muscle feel the same to the person doing the stretching. So which one is it? See what I'm saying about it should work. If you do a little light stretch, hey, that feels good, and you go about your business, great. You do a little light stretch and it still continues to hurt, you are probably tearing muscle tissue, you're tearing ligaments, and you are worsening the injury. And that is exactly what we're going to tell you here. Most injuries are to the collagen fibers that are the building blocks of ligaments, bone, cartilage, muscle, and pretty much every other tissue in your entire body. And so when the collagen is damaged, this causes, here we go, an inflammatory response that needs to repair the damaged tissue. The inflammation is the source of pain. It's not a tight muscle. It's not something being out in your back. It's a real, live, honest-to-goodness injury, just like you cut yourself or something, right? That's the problem. You're not going to stretch that. You're not going to exercise that away. It needs to heal, just like a cut. This can take several weeks or months to heal, and this depends on the extent of the injury, right? So here's the question. How can stretching or exercising torn and damaged tissues make it feel better, let alone help it to heal and recover? You're continuing to tear what's already torn. And if it did scar up, see, oh, it's stiff, that's the stiffness that you feel. Now you tear the scar tissue. And it's not a re-injury, it's a brand new injury each time you do that. In fact, ligaments do not like to be stretched at all. That's one of the big problems with yoga. People get into these positions and they lay into the ligaments and stretch the crap out of them. They don't like to be, I know. Crouching tiger and your friends can't do it. Ligaments don't like to be stretched. End of story. That's it. So that's why I say if the stretching works, pain goes away, and you're back at it. And if that's the case, then it wasn't a collagen ligament type injury. On the other hand, if the stretching doesn't work and you feel worse or like you need to keep stretching, you'll find that people, when I first started, I only needed to stretch 1 time a day. Now, if I don't stretch 10 times a day, I just don't feel right. Stop. You're hurting yourself. You're harming yourself, right? So if the stretching and exercise don't work, you are only further damaging the injured collagen tissue and ligaments. You are. You're just hurting yourself. Good. So what should you do to help yourself? Well, first of all, after an acute injury like that, avoid stretching and exercise. Boy, good. Avoid low sitting like in sofas, lazy boys, recliners, or propping up in bed to watch TV or to use your computer or to read or anything along those lines. Why? Because it stretches the ligaments. Good. You want to ice that injured area, and we talked about icing before. It's about 20 minutes on, wait about an hour to an hour and a half for the blood to return to the skin so you don't frostbite. That works out real well. And you want to take many short walks. A short walk would be about 3 or 4 or 5 houses down the street, turn around and come back. I want your arms moving and your legs. So this is not dog walking or walking along with a kid or anything else like that. This is just straight out walking, turn around and come back. Good. Other thing people can do, and you might be familiar with them, they're called glute squeezes. So you stand, you squeeze your glutes as hard as you can, like you got to go to the bathroom really bad. You pull up into the pelvic girdle, you hold it for 10 seconds, then you back off. And you do this at least 10 times throughout the day. Okay? That would also work. That reactivates the core. So, if you absolutely have to stretch, like we said before, the stick or the foam roll are the best way because you get all of the benefits of a stretch without tearing the muscle tissue and re-injuring yourself. If you still have questions about self-care, you can always come to the pros at Paragon Chiropractic, right? Or give us a call or an email or stop by and we'll show you what you can do to help yourself. All right. So with that in mind, if you think about it, hit the like button, comment, give us a call. We'll show you how to take care of yourself. And in the meantime, take care, and we'll see you back next week. I'm Dr. Dave, Paragon Chiropractic.